Well, welcome back. Thanks for staying with us. Local hospitals are reporting we are in a fifth COVID surge. This comes as the CDC updated quarantine guidelines Monday. 40 WMGT's Ariel Schiller spoke with local hospitals about how they're adapting to the guidelines and what they expect from the surge.
The CDC updated quarantine guidelines Monday, shortening the recommended isolation time for asymptomatic people with COVID-19 from 10 days to 5 days. The CDC says this should be followed by 5 days of wearing a mask. If you still have symptoms following a 5-day isolation, continue to stay home until you feel better. Then start the 5-day period of wearing a mask post-isolation. Local hospitals like Houston Healthcare say they're making adjustments to follow CDC guidelines.
Especially for healthcare workers, that will help us a little bit in case workers do get sick. It's a little different for the workers than it is for the general population. Healthcare workers still should be quarantined for about 7 days.
Dr. Sandy Duke, Chief Clinical Officer with Atrium Health Navicent, says he thinks we're seeing the beginning of a fifth surge. According to Dr. Duke, there is now a 7-day rolling average of more than 7,000 positive COVID cases a day across Georgia. He says their emergency room and urgent care centers are very busy. While few of those patients do require admissions, they do expect an increase in hospitalizations in the coming weeks.
The word we're hearing is that this new variant Omicron requires less hospitalization, but the jury's still out on exactly what that'll mean as we see significantly increased numbers.
Piedmont MACON Chief Operating Officer Scott Strong says they're monitoring the numbers closely. While they've seen positive cases double in the last week, it hasn't translated to hospitalizations. He says they've been in a continuous state of preparedness by limiting visitation, making sure to use PPE, and limiting in-person meetings. While they're also following the new CDC guidelines, the hospital has modifications in place.
Those patients that are immunocompromised or those that are suffering from cancer and those kinds of things are highly susceptible to infection. So for those situations, we're not following the 5-day quarantine. We're actually taking the extended period and not exposing those folks.
Dr. Stewart says the trend of this variant shows more children being hospitalized. Currently, most of the patients are in the Atlanta area. He says even though we haven't seen the hospitalizations reach Middle Georgia, it might not stay that way much longer. He recommends anyone who can get vaccinated should.
Their older siblings, they're above 5, and their teenage siblings and their parents and their grandparents can all get their vaccines and their boosters. And so there's really no reason why they need to be unduly exposed.
In Macon, Ariel Schiller, 41 NBC News.
And we'll have links on our website, 41NBC.com, where you can find COVID testing and vaccines locally.